Before beginning the video, I'd like to take a moment to introduce the 2012 International Congress on Cartilage Repair of the Ankle, to be held in Dublin, Ireland in March 2012. Congress will be chaired by Dr. John Kennedy, Professor Nick Van Dyke, and Dr. Richard Ferkel. We are fortunate to have 25 internationally renowned faculty members and special guest speakers. We encourage everyone to visit the Congress website at www.esska-afas.org/Dublin 2012.
Welcome. This is a video showing a structured surgical technique for identifying the hind foot structures under endoscopic surgery. First, the posterior intermalleolar ligament and its superior tibial insertion band will have to be identified. These structures provide the horizontal and vertical vectors to divide the hind foot into 4 quadrants. These quadrants are superolateral, superomedial, inferomedial, and inferolateral. Here, the posterior intermalleolar ligament is visualized, running laterally to medially, with some of its bands attaching to the lateral talar process. This divides the quadrants into their superior and inferior components, and here the superior tibial insertion band is visualized, dividing the quadrants into their lateral and medial components. So in our sequential approach, we start with the superolateral quadrant. The important structures identified here are the intermalleolar ligament and the posterior tibiofibular ligament. The intermalleolar ligament may be involved in impingement syndrome, and the posterior inferior tibiofibular ligament is identified here, which is also known as a deep transverse ligament. This leads us to the superomedial quadrant, which contains again the intermalleolar ligament and the flexor hallucis longus tendon. The FHL tendon is visualized here. Caution must be taken at this point, as the neurovascular bundle lies just medial to the tendon. We can see that the tendon has lost its normal striations due to stenosis. The FHL tendon must be inspected fully and carefully, as studies have shown that up to 85% of patients undergoing surgery for hindfoot pain have some degree of FHL tenosynovitis. Possible pathologies include a low-lying muscle belly, which may be removed, as well as tears and vinculae, as can be seen here. Again, it is important to exercise caution when debriding at this site due to the proximity of the neurovascular bundle. This leads us to the inferomedial quadrant, which contains the posterolateral talar process. This structure may be also known as, in pathological conditions, as a stata lesion or ostrigonum. A prominent stata process can be seen being removed here. The last quadrant is the inferolateral quadrant. This contains the posterior talofibular ligament and the calcaneofibular ligament. The posterior talofibular ligament can be seen here, and here we've identified the calcaneofibular ligament. Once we have completed our 4-quadrant inspection, we can proceed to the interarticular spaces, which include the tibiotalar joint and the subtalar joint. Here we are inspecting the tibiotalar joint, proceeding from medial to lateral. And then we proceed to inspect the subtalar joint. It is important to have a systematic approach when performing any surgical procedure. This is particularly true for hindfoot endoscopy. This four-quadrant technique provides a structured approach for identifying hindfoot pathologies under arthroscopic surgery. Thank you for taking the time to watch this video.